Hepatorenal syndrome. The risk factor of hepatorenal syndrome is advanced cirrhosis with portal hypertension and edema. Advanced cirrhosis with portal hypertension and edema. Precipitating factors are reduced renal perfusion. There may be excessive diuretic use. There may be NSAID use. These three is very important cause. Reduced renal perfusion, excessive diuretics use, and NSAID use. And the other precipitating factors are GI bleed, vomiting, sepsis, SBP, and if there is uh, reduced glomerular pressure and GFR happens in NSAIDs. Diagnosis done by if there is renal hypoperfusion, if FeNA is less than 1%, if absence of tubular injury, no RBC, no protein, and no granular crust in the urine, and no improvement in renal function with fluid. This is very high yield point, that no improvement in renal function with fluid, because if there is hypovolemic AKI, there is improvement of fluid. There will be improvement in fluid, but in case of hepatorenal syndrome, fluid correction will not gonna improve the patient. And treatment is addressing the precipitating factor like hypovolemia, correct the hypovolemia, correction of anemia, and correction of infection. For splenectomic vasoconstrictors are octreotide, midodrine, norepinephrine, and liver transplantation should be done. IV colloid solutions like albumin are used in the treatment of hepatorenal syndrome and spontaneous bacterial peritonitis. Another important topic is hepatopulmonary syndrome. It results in intrapulmonary vascular dilatation, AV shunting in the setting of CLD. Condition characterized by hypothermia, intrapulmonary vasodilatation, and portal hypertension in the presence of cirrhosis. This patient has two symptoms like platypnea and orthodexia. What is platypnea? That means dyspnea when moving lying to sitting. Dyspnea when moving from lying to sitting. And orthodeoxia, it is a major clue hypoxia upon sitting upright. So platypnea and orthodexia, think about hepatopulmonary syndrome. And for hepatorenal syndrome, look for the precipitating factors, look for FeNA. That's all.